Keep it pressed to the yellow one. That's what I do it one. Yes. Try now.
Testing.
Yes, perfect. Okay, let's start the second part of the talk.
All right, so in the second part, we're going to focus on cases where AI does not work, or at least misapplied. So let's start with a cautionary tale. So how many people in the audience are familiar with IBM Watson? And out of these people, how many are familiar with the failures of IBM Watson? Okay, all right. So that's a good place to start. Okay, so IBM Watson is one of IBM's, or actually it's the flagship project of AI in healthcare. So it started a number of years ago. So the claim was that IBM Watson, their AI system, it will revolutionize healthcare. And it's not a bad system. It's actually a decent system. The problem is that the promises that IBM made regarding IBM Watson were just overblown. So as an example, so they were working with, I believe, with the university system in Texas to identify cancer patients in the field of oncology. And so after the university had spent $62 million, they canceled their contract with IBM. So now you may ask, IBM is a world-renowned organization responsible for a lot of innovations. How did that happen? So let's actually take a step back. So if you read any news related to AI in the media, it doesn't matter where it's coming from, always take it with a pinch of salt. So basically, always go back to the source of the news. So like, was there a research paper where the discovery was announced? And even in the research paper, the claims that the researchers may be making, they may actually be overblown. Okay. So basically what happened in the case of IBM Watson was that they promised that the system will work. All that you need to work really well in diagnosing cancer, all that you need to do is basically take all of your data, feed it to the system, and you will get highly accurate predictions. That's not going to happen. Just for the system to work, they actually needed an army of engineers, software engineers, data engineers to transform the data in a format which could be used by IBM Watson. So that was the first big red flag. And second, when the system was created, so after they had massaged all of this data, the data was cleaned. When it was put in the system, and afterwards, they asked it for recommendations. So say whether somebody has cancer or not, and what recommendations, what actions should be taken for that person. So it turns out that the recommendations that IBM Watson was taking was opposite to what should have been done. So in some cases, or many cases, the recommendations that it was making, if those recommendations had been taken, that would have resulted in worsening the condition of the patient. So this is after literally years of engineering the system and spending $62 million. So again, that's the reason why the contract was canceled. So yeah, it's easy to overpromise and hide things. When it comes to delivery, at the end of the day, what matters is, does that system work or not? So that's just with respect to IBM Watson. That's the most famous example where the system does not work. There were other use cases. They also worked with the research team in Korea, and it turns out that although it's a less publicized case, its accuracy, its performance was even worse. So the cautionary tale, or the thing to learn here, is that there are a lot of things that AI can do, but those claims regarding what it can do, they should be based on after the fact, so based on its performance after you observe something. So don't promise that you can do anything and everything, because the technology may just not be there. So that's, I would say, one important lesson to learn. Okay. So this is a use case I alluded to earlier. And so for the sake of completeness, I'll describe it again. So this was a study that came out not too long ago. So here the claim is that genome-wide analysis identifies molecular systems and 149 genetic loci associated with income. Okay. So basically what this is saying is that an analysis of your genetic makeup, your DNA, can be used to predict your income level. Okay. So the problem with this particular claim is that you can actually do exactly the same by a model with just 4 variables. So your age, race, gender, and your zip code. You can do the same exactly. Then you can say, well, maybe that's because zip code, especially in the US, that's highly correlated with race and income. So why is that? Maybe there's some real science behind this. So the problem is that, so even though the authors may not be making claims regarding causation that your genes are causing you to do well in the world and your high income, but more often than not, that's the conclusion that most people draw out of things. Even if you add a dozen disclaimers in your research, that's exactly what happens. So what's the danger? The danger is that without us realizing it, our machine learning, our AI systems may actually be used for eugenics, making claims regarding superiority of one set of people, of one set of race, or another set of people. Because at the end of the day, the models are going to reflect what the data is. So if there is systematic bias in society regarding certain people, so for example, in the United States, African American or people of dark skin, data is not necessarily going to show the oppression or how they were historically treated. It will just show you the outcomes. And from that, some people may be tempted to conclude that there's inherently inferior about one set of people regarding the other, or if you create models, say, which are supposed to make decisions regarding one set of people, those will be biased because of that. So one use case that basically illustrates that is as follows. So another study that came out not too long ago. So this is just a few months old. So what these researchers did was to analyze data related to different types of decisions which are made regarding people, African Americans, Black people in the U.S. Healthcare system. So what they observed was that if you're an African American, for a number of decisions, the algorithm does not recommend certain types of treatments, or it recommends less often. Versus, say, a Caucasian person or a person of European descent, basically a white person, they go to the healthcare system, they have the same exact problem. The algorithm will actually recommend that, say, they see the doctor or they get certain type of treatment. It's not doing that for the African American person. So now let's take these two premises and let's put them in a larger context, a larger time span. So now if you're a Black person in the US, you do not go to the hospital, the system recommends that you don't get this treatment, or you just go home, or it's something minor. And when in reality that may not be the case. And suppose that half a dozen such decisions are taken over the course of 15 years. So if you aggregate this over a larger span of time, what is the end result? The end result is that that person is getting less amount of care. Because that person is getting less amount of care, their overall health may actually reflect that. And that is also reflected at the level of communities. So the disparity between, say, African American communities in the US versus other communities, just in terms of healthcare outcomes. So one question to ask is that, so it's not the case that there is some league of evil software engineers who sit down one day and they decide to create AI models to discriminate against black people. So these systems are audited, and that's not the case. Basically, the problem is that there's systematic bias against certain groups in different societies. So in the United States, it's against African American people, and because there's this bias, historical bias. So these models, in this particular case, are trained based on history of referral. So if you're an African American person, so if you go to see a doctor or say a nurse practitioner, you're less likely to be given more care. And so that information is being recorded historically. So now aggregate that over decades. Now you basically build, once you build AI machine learning algorithms, they're going to reflect that bias. So that's basically our AI systems, not just in healthcare, but in general, they reflect the reality of the world of the past. And so the society is biased, and the society is discriminating against certain people, and the algorithms are also going to do that. One difference is that because you're talking about systems which can be audited, so even though we may not, the models may be so complex that we can understand what these models are, at the very minimum, what we can do is at least analyze and debug their output. So if we can do that, then there are ways to unbias machine learning models, even in cases when we do not understand how the models work. So in case of deep learning models, you can still unbias these models. So that's the good news. And the thing is, this type of bias that we're talking about is not limiting to AI or machine learning. There is, in healthcare in general, there's actually a bias in terms of literature, in terms of treatments. Historically speaking, it's mainly because it's a reflection of who has created the literature. So the bias is with respect to racial groups, so people who are non-Europeans, they're not representative. It's also with respect to gender. So there are a lot of studies with respect to a number of diseases where if you look at the recommendations, they actually do not make sense when it comes to women, for example. Okay. And one of the most extreme examples which is given, and this is a real example and I'm not making this up, is that there was a study with respect to making recommendations regarding women who are pregnant, and it turns out that that study was done exclusively using data from men. So again, it's not a new phenomenon, there's bias, but okay, one thing to remember is that many of the problems that we are encountering in AI with respect to data and also models, these are not real problems. What AI and machine learning is illuminating is that these problems have existed in society, but now we can have a quantitative view of the extent of these problems. And I think that is extremely useful in itself. And there is also promise, at least a promise, that we can unbias these models. So one reason why this is really difficult is that regulations. So there are a number of regulations in place. So like the European Union has GDPR, General Data Protection. In the US, the government is also trying to regulate AI and its usage. The problem is that the field is moving so rapidly that it's next to impossible for regulators to keep up. And secondly, the society as a whole is not literate regarding how machine learning works. I mean, many of you may already have seen the famous testimony of Mark Zuckerberg describing how the internet works in the US Congress. And basically the person who is asking the question being clueless about technology. And these are the people who are actually setting the precedent not just for the US but for the rest of the world. So you can imagine how difficult it is to regulate these technologies. Okay. So what many of these examples illustrate is basically the fact that there is some way to, or there's a need to audit machine learning systems and AI systems, especially in high-stake domains like healthcare, the criminal justice system, so on and so forth. Okay. So how do we do that? So one way, which was actually the focus of the last tutorial, is that one way to get accountability is that we have models which are explainable. So that said, that does not always work. There is a trade-off between explainability and fidelity of explanations. There are just certain use cases where it's just unavoidable. So that said, one thing that we did not discuss last time was that even if you have black box models and if you just focus on auditing its output, you can still get an idea of how biased the system is. And then you can, say, modify the models in one way or the other to actually at least reduce the bias. So for example, so if you have, say, a model, let's just take an extreme example outside of healthcare, criminal justice system, which says, recommends sentencing for, say, African American people more so than for, say, people of European descent for the same exact crime. And this is a real example. Even if you have a black box model, you can modify certain parameters in the model to ensure that it's fair in both cases. So that's something which is doable. So just based on those observations, so one can actually talk about the future of machine learning systems, at least in domains where we are dealing with human data, the healthcare domain, or say in the social sciences, or in cases where the decisions are very high stake. There is a risk associated with the decision itself. So this visual is basically the subset of how machine learning is done right now. So you have some data which may or may not be protected. You have to process it. You basically input it through a machine learning algorithm. Again, it doesn't matter what the algorithm is. You get some output, and that's basically the end of the story. That's how machine learning and AI is done in industry and also in academia. But in the future, and this is also, some would argue that this is already the present, is that in addition to your predictions, you also need some sort of way to audit. So we talked about explanations yesterday. And then in addition to the explanations, you also need an auditor which can audit your system with respect to fairness. And so presumably there will be a feedback loop where, say, if your explanations are not satisfactory, then maybe you need to go back to the drawing board, use different data sources. Or maybe if that's not a high enough requirement, then you focus on fairness, again, depending on the use case. And so if you score low on fairness metrics, and again, there are multiple ways to define what fairness is. So there are actually 7 canonical definitions which are being used in literature right now. Then you go back and update your models. So this, I would say, in one view, somewhat simplified view of where the field is heading as a whole. Okay, so I will end the tutorial in the same way that I ended the other discussions. Okay. So what do these use cases, both positive and negative, show? So so AI and machine learning, they are powerful tools when it comes to, or they could be powerful tools when it comes to applying them in healthcare. There are already a large number of use cases where they have proven their worth. Even despite that, the majority of the healthcare system, even in, say, the most developed parts of the world, they are not currently informed by artificial intelligence. So there is still a lot of room for improvement. And then secondly, despite what the media tells you, despite what the hype is, creating a system which is truly automated, where AI is doing everything, or at least most of the heavy lifting in terms of thinking, those systems are still very far away in many domains that we may actually be talking about decades. And also in domains where we do have these systems, there's a very real danger that the performance of the model, maybe that's just an artifact of the data. It's not always clear if that's the case or not. So because of that, auditing machine learning and AI systems, that has actually come to the forefront of research agenda. So because that's something which is no longer theoretical, these systems are already being used to make life and death decisions related to people. So that becomes an important aspect. Okay, so now let's take everything, all these 4 or 5 factors that I just described. So basically, when you hear claims like AI is going to replace humans in domain X or domain Y, any task that requires low cognitive skill or it's repetitive, I think that's almost certainly going to be true. But most tasks in healthcare are actually not like that. You do require a fair amount of thinking, cognitive skills. A lot of tasks are very context dependent. So that is not going to happen. That said, if we compare, say, a physician of the future, or even the present, if he or she is using AI machine learning to make decisions, that person is going to be more effective as compared to the person who does not. So think about a physician who refuses to, say, use a stethoscope. I mean, they can still function, but their functionality would be limited. And so when thinking about artificial intelligence, the view that one should take is that it's something assisted. It's a tool, and this applies not just to healthcare, but I would say in almost all domains where it's applied. So with that, I will end the discussion for today. And so if there are questions, comments, I would be happy to address them.
If one has any questions,
actually, your example of genetic locations and income association is a good example for, I think, confounding
Yes.
subject. We can show it in medical fact as an example in biostatistics. So, what I mean, in such issues, we most of the time we use stratification of the data to show the confounding issue in regular medical research. But is it hard for AI to stratify those data to prevent such issues like the things happen to African Americans in healthcare, and also the law issues you told us, and also can we use AI to find such confounding issues, not only in healthcare but also in many kind of research?
Okay. So one issue is that so many of these problems are discovered after the fact. So take this particular study, or say I described applications within the criminal justice system. So one of the reasons is that it's not necessarily biased within the research community. The problem comes is that so interest in AI has come and gone over the last 60 years. One thing which is different with the current boom in AI versus previous booms is that there is a massive amount of money associated with its application and also misapplication. So the criminal justice example that I gave, so over there the problem was not necessarily that the system is biased. We know that's biased because of bad data. The additional problem was that the company who created that model, so they stated that their model is proprietary. So it's our commercial product, it's proprietary. We cannot share the model with the government because the government was using it in the courts. Because if you do, then you can just copy it. How will we make money with it? Say 20 years of research creating this model. Okay. So the issue is that dealing with these black boxes, where these individual companies, these organizations, they create. So in this particular case, their model is actually technically not a black box, but because they are providing that as a service, when the government buys it, or say the end user, they have to treat it as a black box because of proprietary reasons. So that's one thing which is fueling this issue. There's money involved, so that's one. So the other issue is that so the media also works on hype cycle. So if you just go and search on artificial intelligence on Google News, you will see extremely large claims regarding things which are not feasible. So one example is, so there was an article that came out a few months ago, actually multiple articles, which were AI can read better than humans. This was literally the headline. But if you actually look at the study which corresponded to that particular use case, it's basically in the US for, I believe, either grade 5 or grade 7, there's a particular test, and on that particular test, these researchers created a comprehension system which could answer questions slightly better than 5th or 7th graders. So the claim should, and the others actually don't make this claim, but the claim should have been that it's for that particular data set, for that particular setting, the AI models are slightly better than average. But how it gets translated, and the other thing is that vast majority of the public is just not educated about AI or machine learning. That's just not their way of thinking. So to cut a long story short, yes, it is possible, especially for research communities, to catch this, but unfortunately, because of how things get commercialized, how the media works, that's not the reality of the world.
Any other question?
Yes.
There are some discussions about the data size. Can we always say bigger data is always better?
I would say that's a very use case specific question. So we can ask a question like, let's say for predicting, I'm going to make an example, for predicting risk of diabetes for the next 10 years, is more data better? And there are two different ways you can define what constitutes more data. So do you mean more features or more different types of data? So suppose previously if you're just using labs, vitals, demographics, and more data could mean medications, then yes, for this use case the answer is yes. If you had access to a person's medications, then yes, you could build better models. So the other dimension is that more data corresponds to, say, more patient data. Then things get a little tricky, because now you also have to define with respect to what dimension. So suppose we had, say, so suppose we have data for, say, predicting readmissions for a hospital in Üsküdar, okay? And let's say 30,000 patients. So the model works really well. So if we had, instead of 30,000, say if we had like 40,000 patients, it's unlikely that the model performance would change. However, suppose for some reason, I'm going to make up some example. Say people from Izmir started to settle in Üsküdar, and that changed the underlying population of the hospital. Then maybe it's possible that the performance of the model starts decreasing, and we need additional data. So not necessarily say 500 more instances, but 500 more instances of people who would migrate from Izmir to Üsküdar. So there is the question of getting additional data, but if you already have a representative population, then may not have that much. But if there's certain subpopulations on which our model is not doing well, then sure. So the other use case where it would be useful is that if you have a problem where deep learning tends to do really well, then in that case, bigger is always better up until a particular point. So other questions, comments?
Any other questions? Any comments? Okay, so let's talk, Dr. Ahmed, for 5 tutorials and 1 seminar in coming to Turkey and visiting us for